Ohioans know the problems we face don't care if you're a Democrat or Republican. They're just problems that need to be solved. So when the most unprecedented public health crisis of our lives hit, I thought about saving lives, not politics.
That was Dr. Amy Acton. Once dubbed the Dr. Fauci of Ohio, she oversaw the COVID public health crisis at the onset of the pandemic. She stepped down just a few short months after. Fast forward 5 years and Acton now hopes to lead Ohio with a new role, governor.
But the state's former health director's past COVID crisis handling may catch up to her. She backed strict COVID policies at the height of the pandemic, a sticking point for GOP gubernatorial candidate Vivek Ramaswamy. He's already ratcheting up those attacks. Joining us now is Dr. Amy Acton herself. Dr. Acton, thanks for joining us. We'll start with just setting the stage. Why did you decide to run for governor, and what are some of the key policy issues that you would focus on if you were elected?
Well, thank you, Amber. I am running for governor because people in Ohio are struggling, and I refuse to look the other way while our state keeps going backwards on nearly every measure. Everywhere I go in this state, I hear about folks wanting a change.
And obviously your opponent is pretty well known, Mr. Ramaswamy. What's wrong with him? Why is he unacceptable in your mind?
Well, I'm a doctor. I am not a politician, but I am a lifelong public servant and a problem solver. And what I am hearing everywhere in this state is that folks are tired of the special interests, wealthy folks putting their interests above the needs of everyday Ohioans. Right now, not unlike our federal budget, we just passed an Ohio budget that gave tax breaks to the wealthy folks who were not even asking for it at the expense of our health care for everyone, our rural hospitals, our schools, our libraries, and the list goes on and on. People are telling me they are longing for public servants. They don't care what party you are. They want to see you solve problems instead of making them, which is what we're seeing in our country and our state today.
All right, let's address the elephant in the room, which is that you've been getting a lot of criticism over your time helping direct the state's COVID response. Vivek Ramaswamy has specifically attacked you for closing schools in the final semester of 2020 during the pandemic. Do you have any regrets about how you handled that situation?
Well, alongside Governor DeWine, our priority was saving lives and getting us open earlier, which in fact Ohio did. I'm very proud of the leadership of Ohio. I'm very proud of the actions everyday Ohioans took to save one another. And while certainly my opponent who is attacking in that way, the truth is actually quite the opposite. And I take issue with calling me the Dr. Fauci of Ohio. I was the Dr. Amy Acton of Ohio, working alongside a Republican governor and every sector of the state to save lives. And what we did was in an unprecedented time. And I hear everywhere I go, there is a bond that has formed with Ohioans. It does not know party. We see record numbers of folks showing up, including lots of independents and Republicans. That bond is deep. They know that we are working hard with them to save lives.
Okay, but fast forward to 2025, there's been a lot of research and more research still coming out on the really damaging effects on kids of school closures. And at that time, there were at least 12 states that allowed schools to stay open and allowed kids to have in-person learning. So just to ask more directly, did you make a mistake by closing schools?
No, actually, what we were following was the pandemic playbook. What is being missed in looking at 4 years of data is my order was in the first weeks. We couldn't keep anything open because it was collapsing of its own. The superintendents were asking us for help because at most risk right then were all the bus drivers and the cafeteria workers and the teachers. Our focus was actually on how to keep kids learning, which was an impressive effort done by all the schools working alongside our governor, a Republican governor, and many, many states actually, and even the federal government made those closures in the beginning. And I think there's a lot of confusion. We actually reopened earlier in Ohio because we took decisive action And our schools were able to open, and the locals had the control to make the decisions from that fall onward. But in those early days, it was, I believe, the right decision we made.
Dr. Acton, I take the point that you want to discuss other issues in addition to this one, and I also take your point about the Dr. Fauci of Ohio thing, that perhaps that is a bit crude. But I'm just reading the Politico story that was recently done on your campaign, and it talks about the fact that you did at that time suffer what they describe as non-stop demonstrations outside your home, which included armed protesters. And it quotes you linking your experiences during the pandemic with where we are now, saying that you tell voters, quote, "I saw under the hood during COVID, I saw how fragile our democracy is." So just flesh out what you mean by that. What fragility did you see there that is still manifesting itself today?
Well, absolutely. We know that folks in my position, 400 folks were under attack, either lost their jobs or stepped down during that time. The hate was real. But as I tell Ohioans, the love and the way that we were rowing together as a state was so much greater than the hate. But there was a plot to kidnap Gretchen Whitmer. We were under those same sorts of threats. But sadly, we've seen that go on to every school board, every nurse walking to her car. Librarians are dealing with that. It's a travesty. Violence is not okay as a response to people who are doing public service. For me, that was not a factor in my decision making. I did make my decisions during that time based on pressures that were actually for orders coming from our state house that would harm people. And as a doctor, I will always both honor my oath to the people of Ohio, as I have, but also the Hippocratic Oath, which is to do no harm. My job is to alleviate suffering. And I'm running for governor because the folks in our state are suffering. They're suffering from a pay-to-play legislature that continues to take our state in the wrong direction on every measure. We've gone from a state being one of the highest health outcomes to living shorter, less healthy lives. Our public schools are under attack right now. We're not funding a bipartisan funding program for our public schools. Libraries are under attack. We're losing hospitals. People have to travel an hour and 15 minutes to deliver a baby in my state. That is not okay. We are capable of so much more, and that's why I'm running for governor.
You mentioned that there were orders that you were being pressured to sign that you thought would have cost lives. Can you elaborate on what those were?
Yes, one of the greatest things, and folks don't realize, COVID was a pandemic playbook that came after 9/11, written by George W. Bush, recognizing that the gravest security risk to our country was either a biologic weapon or a pandemic, because it absolutely uncouples everything. We saw the supply chain completely fall apart before a single order was written in this country. And that bad actors would take advantage of it and pit us once again against one another, which we've seen since. But the fact is, those decisive orders we were making were passed from president to president. It helped save lives. People don't realize folks were dying of heart attacks and strokes because there weren't enough first responders to care for them. That is what we were facing in the beginning. But once again, special interests in our state house used COVID as another leveraging tool to give certain businesses advantages. And in one case, there was an order for fairs, 15,000 people unmasked in stands as we were trying to stand up our businesses again and trying to get our schools open. So for me, I kept advising a Republican governor many years after that, but I could not put my name to that. And for that, we're very honored. We did receive a Profile and Courage Award from the JFK Library for those actions.
And just to follow up on that, there were states that did have these large events at that time. And, 5 years on, we see that the health outcomes for those states were as good as, or in some cases better, than states that had longer lockdowns. So where is the evidence that your specific response in refusing to open up certain businesses had a very positive impact on the population, considering as well that
Amber,
there were a lot of drawbacks to
Amber, I'm
lockdowns.
here to talk about my run for governor.
Right, but
And
people
we
care
do
about
have
this.
evidence that showed Ohioans saved lives and more people did better than neighboring states. There are different phases to the pandemic. And early on, we had to stabilize our hospitals, which we did. And we actually had a lower rate of spread in Ohio. And that evidence is out there. But I'm here to talk today about affordability and the fact that bad actors are taking our state in the wrong direction. And the people everywhere in this state, Amber, that is not the answer I'm getting. They're coming in record numbers. We have 3 independent polls now showing me very competitive in the general because Ohioans formed a bond of trust in leadership that took decisive action to save lives and to open earlier, which is exactly what I and a Republican governor did.
Yeah.
And if you doubt this fact of that appreciation, governors all over who took those decisive actions on both sides were reelected again. There is no evidence that it harmed them leading during an unprecedented crisis. People want leaders who put a North Star of our common purpose again, use common sense as we did for the common good. And I'm very proud of my service for Ohio, and I want to serve more because I know the people in my state need leadership that affects things that affect their daily lives. And that's why I'm here, and I'm going for this because the people want to see change.
Yeah, and look, I understand that you want to talk about other issues, but that is a point in your career where you were in a leadership
There's no
position.
evidence that all the polls show actually my favorabilities are higher than every elected official and my negatives are 20 to 30 points lower. So the people of Ohio do not agree with you.
The people of Ohio don't agree that your time as a leader of the state's public health response was important and relevant
They believe
to your
it
run
was
for governor?
and they actually appreciate the leadership. And that's what the numbers in 3 independent polls show. This thought that COVID is a reason to not run is not.
I'm not
supported by
suggesting you
evidence.
don't run for governor. I'm merely asking you questions about your response, which I think are completely legitimate.
Yeah, and thank you. I feel I have answered those. Thank you.
All right, thank you, Dr. Acton. We appreciate you coming on the show.
Niles, do you have any other questions?
Okay, well, since we're here, I'll ask. Okay, so I mean, in your state, President Trump carried it by about 11 points last year, and obviously, you know, we have other governors around the country who have been who have pushed back very firmly against him. Now, I'm thinking particularly of Governor Newsom, California, a very different state from Ohio. How confrontational would you expect yourself to be with President Trump if you actually do win the election in a state that is leaning, I think, increasingly Republican?
I think the people of my state need a governor, an attorney general, and others to be pushing back on actions that are harming Ohioans. The changes to Medicaid are profound. As I've said, our rural hospitals are closing. This is a real threat for the children of our state. You know, some of our kids live in poverty, up to 50% in areas of our state, and 40% of children are on Medicaid. It also affects the elderly. It affects those with disabilities. These policies are bad. We are giving tax breaks and actually increasing the debt at the expense of doing the public problem solving that our Ohioans are asking for us. They need us to be solving issues of cost, and it's more than just gas and groceries. They're caring about childcare, they're caring about aging in place, about feeling safe in their communities. We need a budget that represents the values of the people, and we are seeing everywhere we go record numbers of people asking for change. And as I said, it doesn't know party. People are longing for public servants who put our greater good first and foremost.
Dr. Amy Acton, we appreciate spirited discussions here on Rising, and we appreciate you joining us for one of them.
So do I.
Thanks, Dr. Acton.
Thank you. Thank you both.
All right, next up on Rising, and a big win for the Trump administration, UPenn is banning transgender athletes from competing in women's sports and even removing the titles of a famous transgender swimmer.